Hello, my name is Matisyn Hallenbeck, and today I will be teaching my mom about one of my favorite microbes. Okay, so the microbe I've chose to teach you about today is Rickettsia rickettsii. Have you heard of it before?
I have not.
Okay, so it's a small rod-shaped bacterium, and the disease is transmitted to humans through a tick bite or by contamination of a cut on the skin with tick feces. So this is very common in dogs and humans, and yeah. So these cells need a host to grow, but they are prokaryotes, meaning that they lack a cell membrane and membrane-bound organelles due to the lack of intermembrane membranes. So once it enters a human host cell, it will begin the exponential growth phase without a lag period, meaning it will develop and reproduce and very quickly become a pathogen. Now I'll be teaching you a little bit more about how Rickettsia rickettsii functions. So as we talked about before, it's spread through an arthropod vector, which are ticks. They have transport systems and metabolic enzymes and take about 8 hours to undergo binary fission, which is the way they divide as a bacterial cell. It circulates in a zoonotic cycle as it transmits its properties into a host cell. So when a bacteria infects a host cell, it will release its DNA into the cell in order to cause the disease. It triggers an active response that alters cells' phenotypes, which is the genotype is the actual genes and the phenotype is the way that it looks. So it changes the actual actions of the cell. It can infect endothelial cells within human body through vascular smooth mucosal cells and tissue. May also divide within nucleus or cytocell of endothelial cells of blood vessels, which also accelerates the way of its activity as a pathogen. And it can be used as a bioterrorism agent, particularly using dogs in order to carry the RMSF in order to infect humans. Have you ever heard of the disease that is caused due to an exposure to Rickettsia rickettsii?
No.
Okay, perfect. Then I'll teach you about what it causes. So it is responsible for causing Rocky Mountain Spotted Fever, or RMSF, which is actually a very morbid disease. The symptoms appear 2 to 14 days after exposure. You may experience fever, headache, depression, nausea, and vomiting, and may develop a rash called purpura, which comes 2 to 5 days after the onset of a fever. And the photo is an example of this from the CDC of what it may look like. And serious cases may suffer injuries to their central nervous system, pulmonary, and hepatic regions. Do you have any questions?
That foot looks really painful. Does it look like, is this a painful thing?
Yeah, so it's a rash, so it will be itchy and dry. And next slide, I'll talk about the treatments that will actually help treat the illness. Now that I've taught you that RMSF is caused by the exposure of Rickettsia rickettsii, I can teach you about the prevention, testing, and recovery. So in terms of prevention, there are no current vaccines, so it's important to take it into consideration to keep your backyard clear of ticks, check your dogs often if you have them, and check your body in order to keep yourself safe from this disease. Testing is very good. You can get blood tests, which will show evidence of RMSF, which will then most likely lead to an antibiotic treatment, which is very nice that this specific disease has that ability because there are a lot that are untreatable. Recovery, so since this is a deadly disease, it is important to go to the doctor and receive an early treatment of the antibiotic doxycycline, which will help reduce the severity and keep a patient alive. Do you have any questions?
So what does the antibiotic do?
So the antibiotic actually works as an antibiotic, and it will kill off the bacteria in order to stop the spread of the disease throughout the body. So I hope you learned something about the microbe Rickettsia rickettsii today, and make sure you're watching out for ticks in order to keep yourself safe from Rocky Mountain Spotted Fever. And here are a list of my references. I use the CDC, Microbe Wiki, and Meds R Us. Thank you.